YouTube. So it's Ryan, and I am now 19 days post-op with Dr Garramone in Sunrise, Florida. Um, this is just more of a documentation type video, just to show you guys what my chest is looking like. So I will show you now, I won't delay. All of the strips have come off my incisions now, so they are completely exposed, and I couldn't be happier. They are so tight, it's unbelievable. There's not really much pain at all anymore. I get the odd twinge, but that's pretty much it. My nipples are finally looking like they're gonna stick. I've been a bit worried, but that's just me. They kind of just looked like they were just sewn onto my skin, and that's why I was a little bit worried, because they didn't look like it was fusing with my body. But now they look like they're fusing quite well. I'll see if I can show you. You can't see because I'm on my laptop, so I can't get much closer than that. But across the top here, it looks like it's fused really well. Around the bottom, it looks still like it's just sewn onto my skin, but it's looking a lot better than it was. And this is my right nipple, and this one's not fused as much as the one on the left, but a bit round this side and a bit round here. That looks like it's fused, so I'm happy that they look like they can actually stay on, which is a bit of a relief, I must say. The incisions themselves are really clean. They go, that's all the way down there, which you can quite obviously see. They're quite pinky red in person, but obviously you lose a bit of quality on the camera. I thought it was blood then, but it's not. It's just a little bit of scab. Yeah, I couldn't be happier. This is me from the side, so you sort of there you go. So it's, if I suck my gut in, it's really flat, and the same on that side. So there's still a little bit of swelling up around this area, and the same again on this side. It's still a little bit swollen, a little bit tender, but that will go down over time. Also, the incisions themselves, they look a little bit rippled. I don't know if you can see that on the camera. I'll just do that so hopefully you saw that. They look a little bit rippled, but Dr. Garramone said that would smooth out over time. That's just where they're still real fresh, and things like that. So I really couldn't be happier. I'm still dressing my nipples because they've got the majority of stitches still in there. If you're from the UK, you can get band-aids or plasters in America that are quite large, but I've had a lot of trouble trying to find plasters of the same size here. So what I've opted for, I'll just show you guys. What I've opted for is from Boots, or I don't know if Superdrugs do them. You can get little gauze squares. They're 5 centimeters by 5 centimeters, and that's more than enough to cover my nipples. And I presume your nipples will be fairly similar. And then I'm either sticking it down with this, which is like the paper tape. But then that wasn't sticking to my skin very well, and making my skin go red, so I think I might be a little bit allergic. So I got this instead, which is a kind of a stretchy plaster type tape, and that seems to work just as well. I've also got, it's my bag of goodies. I've also got these, which are large, they're Wilkinson's, these ones. Large plasters, and I don't know if these are going to be big enough, so I'm not using them right now. So you can see there, you've got the padded bit in the centre, and I'm not quite sure if that's going to be big enough. I mean, it would well cover my nipple. My nipples aren't that large, but I'm just worried about the Zero Form gauze that you have to put over them, and so I'm going to wait until my nipples are a little bit more healed, and I'm a little bit more comfortable putting things like sticky stuff that close to them, because at the current moment it's a fair distance away with those gauze squares. So yeah, I highly recommend these. These ones are super drug, and I think they're only a couple of quid. So yeah, I highly recommend those. I bought this, was what I got from America. It's antibiotic ointment, and you can get it from Publix, which is like a pharmacy type supermarket type store. And it was real cheap. I think it was only $2 or $3 maybe, not even that. And I also got a pair of what do you call them, hairdressing scissors, and these were also from Publix, and I don't believe these were that expensive either. I think I paid about $7 or $8 for these, and with the exchange rate it's about £5, so that was quite reasonable. And these I used to cut the zero form up with, into squares to cover my nipples, and I boil them. Well, I don't boil the actual scissors, that would be kind of weird. I boil some water and sterilise the scissors in a mug, after every time I use them, to keep them clean, basically, because I don't really want much infection going on near my nipples. So yeah, that's about it. I've been rambling for 6 minutes now about absolute nothing, or nearly 7 minutes. So I'm going to go one last look at my chest. So this is my chest, 19 days post-op, Dr Garramone, and that was a double incision with nipple grafts. Thank you very much for watching. See you soon, guys.